Hello, my name is James Lee. I am a consultant gastroenterologist at the Royal Free Hospital, and I'm also a research scientist with a lab down at the Francis Crick Institute. That's a great question. I decided to become a doctor because first and foremost, I wanted a job where I could work with people and actually doing something that would help people. I was also absolutely fascinated with the biology and trying to understand how sort of complex systems like the human body sometimes go wrong and cause diseases, and then trying to figure out how do you put the pieces back together and make things start working as they should again. Um, so I had experience of spending time in hospitals and with GPs, and the more I saw, the more I just became fascinated by the possibility of actually, making people better and actually letting people get their lives back on track. I chose gastroenterology as a specialty for several reasons. Actually, initially I chose it because it's such a broad specialty. So it has opportunities for hands-on work with endoscopy. It has opportunities for some work with patients who have cancer. It has opportunities for work with people with chronic disease. There's a sort of mix of acute problems like GI bleeding and chronic problems like IBD. So I got into it because initially I thought it would enable me to keep my options open, actually. It was also a specialty that really interested me simply because there seemed to be so many unanswered questions in the various things, particularly in diseases like Crohn's disease and ulcerative colitis, where actually, we had a very simplistic understanding of why these diseases develop, and actually we didn't have, and probably still don't have, really effective therapies that would work for every single patient. But my job is unusual in that I'm not full-time within the NHS as a doctor. I'm actually part-time in the NHS as a doctor, and actually the rest of my time is spent running a research lab. So I essentially have two jobs. So I'm on the one hand a scientist trying to understand what goes wrong when people get these diseases, but actually also a clinician actually treating people with the diseases. And so actually the thing I love about my job is that ability to cross from the research side, where we're actually at the cutting edge and learning new things about the diseases, and then actually seeing people in whom we might be able to make a difference in the future by actually bringing some of these advances into sort of regular clinical care. That's a good question. I think my patients like about me is, and my practice is very focused around patients with IBD and sometimes quite complex IBD. I think the thing my patients like the most is that I actually spend time talking things through with them and actually try to explain it in a way that they understand. So they don't just see a doctor who's telling them what they're going to do. They actually see a doctor who spends a bit of time walking them through all of the sort of thought processes around why we are suggesting a particular treatment or a particular, modality of therapy. I think patients also like the fact that I'm, a sort of key opinion leader in my field, and that, there aren't many questions they can ask me about inflammatory bowel disease that I don't have an answer to. But also the fact that if I don't know, I will say to them, I don't know. I will be completely honest with them. So what they see is very much what they get with me. So as I say, my job is half clinical and then half research. And actually, I often get asked, if you had to choose one of those two, which would you choose? And actually, the answer is I couldn't choose, because I learn so much from my patients. They tell me about the symptoms they're having, the things that trouble them. For a long time in inflammatory bowel disease, we were most worried about, can we get rid of the inflammation? And, we can certainly do that with different drugs, but sometimes that still leaves patients with symptoms that aren't any better. And so actually my patients tell me what the research priorities should be that we need to be working on in the lab, because they're the people who are actually experiencing and living this day to day. So actually for us, the patients are a huge source of both inspiration and actually also, direction in terms of thinking about the research that we do.